Do the eyes matter? Of course they do, not only for good vision, but because it's upsetting to have a gunky eye. There are differences in what causes the gunk between the different ages. So we're going to cover today clogged tear duct, upper respiratory infection, and the regular pink eye people think of. So clogged tear duct, under 1 year of age, usually improves after 1 year of age, and if it doesn't, you'll see the eye doctor. The eye is not red. It just forms this gunky film quite often after sleep, but can throughout the day. The cause? The little hole where the tears are supposed to drain is too small for them to drain well, so the tears just kind of gunk there. What to do? Gently wipe. Now, some people will tell you to push on the little area close to the nose. Well, that's if there's a little bump there, which most of the time there isn't. Are you going to do any harm? Probably not. But just gently wipe the eyes. To call, if the baby has a fever, if there's redness and swelling, especially after you wipe and the eye is still very, very bulging, or the baby is very uncomfortable, you need to get seen right away. Next, upper respiratory infection. These will hit usually after 1 year of age and on up, but especially between 1 and probably 3. The upper respiratory infection causes increased secretions in the back of the nose and the throat, which then push the pus out the eyes rather than allowing it to go down into the back of the throat. What to do? Well, if this is going on for several days, and again, if your child is having fever and is extremely uncomfortable with this, they need to be seen. Next is pink eye. We think of that with the eye itself actually being red, and there's watering and sometimes really pussy mattering. This can be caused from allergy, although not real often, and when you have an allergic pink eye type of situation, both eyes usually are red. Whereas with a virus or a bacteria infection, usually only one eye will be red to start with and then can go to the other one. The important thing here is that most of them are viral, so antibiotics don't really help. However, we usually do go ahead with that just because there is the off chance it is bacterial and they will get better a little faster. Again, if the child has fever or is completely miserable, you want to be sure and ask. Well, the eyes do matter, and give that kid a hug.